I'm Michelle Morisi, licensed acupuncturist at Wu Healing Center. This is part 2 of Introduction to Pulse Diagnosis. We had the first part of the class a few weeks ago that you can also find on Dr. Wu Healing, the YouTube channel. And if any issues come up during this live presentation, I put my number right there. You can feel free to just text me, as I cannot see comments. So just shoot me a text if there's an issue or if you have any questions as we go along. And there might be time at the end to answer some questions. So let's dive in. We've got a lot to cover today as in order to understand the relevance of pulse qualities, which is what we're mainly going to talk about today, we need to know the corresponding patterns of those qualities. And so you may know some of those, you may have some background in it, but we'll go over some of these basic patterns of pathology in Chinese medicine so you know the relevance of these pulse qualities. But first we'll just recap a little bit about the first class to make sure you know where to actually locate the pulse. We're typically using our index, middle, and ring fingers on that distal radial artery, which is basically just the wrist. And these are the corresponding organs that go along with each of those pulse positions, heart, liver, and kidney yang on the left side, lung, spleen, and kidney yin on the right side. And then at each of these three positions, there are 3 depths of the pulse: the superficial level, which corresponds with the qi, the middle level, which corresponds with the shui or blood, and the deepest level, which corresponds with the organs, or the yuan qi, some say, which is our prenatal qi, the qi that we are born with. So you can come back to this slide if you need, or to the first class if you need to review that more. We'll move on. So we talked a little bit about in the first part about what constitutes a healthy pulse. So we're going to dig into that a little bit more. So first of all, yin and yang, very important basic concept to Chinese medicine. We can picture it on a scale, so I'll skip ahead to this next slide. If you look at that spectrum from yin to yang, blood is more on the yin side, more substantive, more nourishing, and the qi is more on the yang side of the spectrum, more, we'd say, configurative, like it kind of gives shape to the substance, obviously more energetic, more subtle, and so we can keep that in mind as we think about these different qualities. So yin gives the pulse substance, and it roots and slows it so it's not too fast, gives it weight, where yang gives it lift and power and force, and it's configurative. It gives something to press against. And the blood gives it volume and fullness, as well as softness, ease, and body. And the qi gives it energy, liveliness, vitality. So a blend of all these things is indicative of a healthy pulse. So first we'll go over, before we go into the individual pulse qualities, we'll go over what a pulse would feel like for these basic patterns of pathology, as you're typically not going to feel, in the real world, people aren't, like textbook cases. They're going to have a mixture of patterns. And so some of these patterns, major patterns, you'll probably come across either in yourself or other people, are qi deficiency, which in Chinese is just chu. It's just easier to spell, so I just using that pinyin. That just means deficiency. So qi deficiency, blood deficiency, yang deficiency, and yin deficiency. And so we can think of the yang and the yin deficiency as more extremes of qi and blood deficiency, respectively. Right? So remembering that spectrum, blood deficiency is kind of like a milder form of yin deficiency, and qi deficiency more of a milder form of yang deficiency, and vice versa. So the qi deficient pulse, some terms that might be used to describe the pulse include empty, yielding, weak, and soft. And then yang deficient pulse will still be weak, but also deep and slow. And blood deficient pulse could be described as fine, thready, or thin. All these words are basically referring to the same thing, basically that the pulse feels thin. It literally just feels narrow in diameter. And always keeping in mind proportion, keeping in mind the size of the person whose pulse you're listening to. And so it can become easier the more people whose pulses you feel to kind of tell what's typical. And then the yin deficient pulse, in addition to being thin, it might be tight, which is it's in addition to being thin, also a hardness to it, maybe floating, which we'll talk more about what that means, and possibly rapid. And so looking at it holistically, what these conditions would look like in a person, these are some of the symptoms that might go along with them, so that you can keep those in mind when you're listening to the pulses, to see if they match up. And again, everyone is unique, and usually multiple factors going on at once. So it's rare to see people who just fit the textbook perfectly, but at least to know, have the knowledge as a foundation is helpful. So basically, qi deficiency is going to result in tiredness and a pallor to the complexion, as well as a shininess, as opposed to blood deficiency. You'll see here the complexion is pale and dull when the blood is deficient. And then, so yang deficiency, like we were saying before, is a more severe version of qi deficiency. So we're going to see those qi deficient signs and symptoms in addition to interior cold. So this could manifest as literally a coldness of the person, as well as slow movement. Also, typically, yang deficient people are going to have like heavier, softer bodies. You can't always predict things that way, but in general, yang deficiency is going to result in that, and where yin deficiency will be more of a thin body. And yin and yang deficiency are both more common in older people as you age. It's just natural that our energy depletes, our substances deplete, and so to some degree it's natural, or it might be constitutional, it may be from chronic illness. And then blood deficiency, there's a lot of different potential symptoms, so you may not see all of these, but dizziness, or just a sensation of instability, or postural hypotension, which is that like when you stand up and you can't see for a moment. Those are all indicative of blood deficiency, as well as visual issues like poor eyesight or floaters in the eyes, poor short-term memory, like we were talking about in the first class. The blood is really linked to our consciousness, and the heart, which pumps the blood, of course, is in particular linked with our short-term memory. So when you have trouble with that, that is indicative of blood deficiency, as well as dryness, like dry hair, nails, or skin. As we were saying before, the pallor and the dullness of the complexion, as well as the lips. Also trouble falling asleep. So I emphasized the falling asleep because with the yin deficiency, there may be trouble staying asleep, more so than falling asleep. And there may be this, with blood deficiency, this anxiety or restlessness or tension, as well as weak tremors or cramps, like if you have menstrual cramps, particularly cramps that begin after the period starts. So that's a sign of blood deficiency. Once something is leaving the body, if there's an issue, that is indicative of a deficiency. And also interesting to note, absence of self-esteem is associated with blood deficiency. So not having like enough blood to kind of fill up and be fully present. Blood has a lot to do with our ability to be present. And so yin deficiency, like I was saying before, this is a more severe, you can view it as a more severe form of blood deficiency. So in addition to the signs and symptoms we talked about, there's also what's called empty heat. And this is, as opposed to true heat or full heat, this is like someone who's not constitutionally hot. Very typical with menopause, things like hot flashes. You know, the person themselves is not, are not dealing with like a constant heat. It's this hormonal imbalance essentially causing these temporary hot flashes or night sweats, or you might see someone with like red flushed cheeks rather than someone who just has a chronically red face. Warm palms and soles of the feet, so not the whole body, just parts of the body. And as we were saying, this trouble staying asleep, right, at this most yin time of the day, night, is if you're yin deficient, there's not enough yin to kind of keep you asleep at night. And so this could be just like someone who's a restless or a light sleeper, tossing and turning. They're exhausted enough that they can fall asleep when they go to bed, but they're not able to stay kind of rooted in sleep. And there may also be this agitation or irritability as well. All right, and so moving on to excess conditions. So actually I'm going to skip ahead to the overall excess presentations, and then we'll talk a bit more about the qualities of the pulse. So, and also it's important to note that excess conditions can be the result, and often are the result, of deficient conditions. So in Chinese medicine, there's patterns referred to as stagnation, so like qi and blood stagnation in particular, and this could actually result from a deficiency of qi or blood. There's not enough to circulate fully, so it kind of gets clumped up in certain areas. But these conditions by themselves are considered excess. And so with chi stagnation, the pulse is going to be called, might be called tense or wiry, especially has to do with the liver. So the liver has a big role in spreading out the chi and ensuring the smooth flow of chi. And if it's not able to do its job, this could result in like discomfort, pain, bloating, especially for emotional stuff, especially frustration or moodiness. And the emotions get kind of pent up. And any kind of symptom that changes in severity and location is usually indicative of chi stagnation. So like a kind of a wandering pain or discomfort that comes and goes. Whereas blood stagnation, this is associated with more severe, fixed, sharp, just ceaseless pain. Pain where people can kind of point specifically to where it is. It could also result in hard masses in the body, tumors. It could also be cause menstrual issues like blood clots or pain, especially premenstrual cramps are indicative of blood stagnation. And also just like a darkness to the complexion, as well as the tongue. It's like could be like a dark purple or red. And then next, dampness, which is especially affects the spleen. And then more severe version of dampness is phlegm. And so this is indicated by a pulse. That's called slippery. So, and then signs and symptoms that go along with dampness or phlegm. More so, these are symptoms of dampness listed here, like a sense of heaviness, weariness, digestive issues like disordered eating, sticky, watery stool, nausea, feeling full in the abdomen or the head. Some people will describe it as brain fog, and fluid-filled skin issues, skin eruptions. Also on a psychological or mental emotional note, there might be a lot of worry and rumination, kind of circling over things. At an extreme, there might even be like an OCD kind of condition, and feeling trapped by multiple good possibilities, indecision, having many unfinished projects, procrastination, inability to make clear distinctions, excessively taking care of others without the ability to take care of the self. So this is where the spleen is working too hard, and it's not receiving enough in response. So there can be this accumulation of dampness, which could result in excess, like overgrowth of bacteria, like an overgrowth of candida. This could be excess flesh or fat. This could be just like metabolic waste that's not being released out of the body, or kind of mental waste that's not being released. And chi stagnation can also play a role in these cycles of accumulation. And then full cold and full heat. I don't really see too many people with these patterns. I tend to see people who are deficient, have underlying deficient conditions, because we just tend to become depleted as we go through life. But there are cases where you might see someone with what's called a full cold or full heat pattern. And basically, I just wanted to note for those, if there's pain, they're worse with pressure, and as would be intuitive, the full cold conditions are relieved by heat, where the full heat are relieved by cold. So we'll go back to this slide going over these different pulse qualities. So these qualities are getting a little more complex to feel than the I think than the deficient qualities, and as evidenced by the multitude of different metaphors and similes and descriptions of these pulses that I came across in just like my notes from school and from books and from classical texts. So you can take a look at these and see what maybe is helpful to you, or maybe you're more of a visual person. So this, I have one image of that kind of gives a visual of a choppy pulse, at least a possible presentation of a choppy pulse. And there is a book that I will be giving you the details for at the end of this that has a kind of visual for all the pulse qualities, and really good, just a really good book in general called The Web That Has No Weaver. So yeah, I'll be sharing that at the end if you're interested in more reading. So chi stagnation, the pulses can be called tense or wiry, and so kind of straightforward. It feels like it has a vibrational quality, kind of like a guitar string. It can be either wide or narrow in its size, so depending on whether there's an underlying deficiency like chi deficiency, or perhaps it's more of a full condition, a true excess condition. And this pulse quality is going to always affect the liver at the very least. So you may feel this quality on all the pulses, or maybe more so on the left side where the liver pulse is, or maybe just in the middle jiao pulses, which are these middle pulses, the liver and the spleen on the right side. But you're never, if you're just feeling it on the right side, it's probably a different quality that you're feeling if it's not on the liver pulse. Same with blood stagnation. This is called a choppy pulse. And so this has been described many different ways. And as you can see this picture, it can present as, I had a teacher describe it as scattershot, where it kind of feels like it's hitting your finger at all these different little points. Or it can be kind of changing, like from one beat to the next. It feels bigger and then smaller, and then it's going back and forth. Or can feel kind of rough, like a river that's become too shallow, and now you're just feeling these rocks on the river floor. That sounds like maybe a blood deficient and stagnant condition. And then for a damp pulse, or a phlegm condition, the pulse, as we were saying, is called slippery, and this is going to affect, at the very least, the spleen. And so it's kind of same thing as I was saying for the chi stagnation pulse, the wiry pulse, the slippery pulse. If you're not feeling it on the spleen, it's probably a different quality than slippery, because the spleen is the organ that's really most affected by dampness. And this is described as a rolling on either side of the finger rather than under your finger. It kind of avoids your finger as you press, so it might also be called the yielding. And it may also feel like you're sticking your finger into a wet sponge. And in that case, it would be a deficient and damp condition, so likely a chi deficiency, and a dampness, which tend to go hand in hand. And then the full cold and full heat pulses are both described as full, so that we'll kind of get more into what a full pulse feels like later, where the cold pulse will be deep and tight, the full heat pulse will be rapid. Rapid is always a sign of heat. And this on the side here, the yin and yang dynamics, is just to kind of show you, give you a visual of what it means to have a full heat or full cold condition versus deficient cold or deficient heat, like we were talking about before. Yin deficiency and empty heat, it's like you have a normal amount of yang energy and a deficient amount of yin energy, and because you don't have enough yin to balance out, there may be these kind of false heat signs. Versus a full heat condition, there's excess of yang energy rather than a deficiency of yin energy causing the heat, and vice versa for cold. All right, so let's get into the pulse qualities. We'll go through them one by one, and so there are generally understood to be 28 classical pulse qualities. Sometimes people say more or less according to interpretation or the source, but we're actually going to focus on 18 of the 28. So those 18 are, I would say, the main qualities that you will probably run into. So they are divided by depth and speed, rhythm, shape, and length. So first of all, for depth, the floating pulse, and I'm also giving the pinyin because these pulse qualities the words can be translated in a number of different ways. So like here for chi stagnation, you might see someone call the same pulse quality tense or wiry. Someone might say choppy or rough. So it's just maybe easier to know the Chinese names. So the floating pulse is a pulse where it is distinct at the superficial level, so the chi level, and less perceptible at the blood and organ levels. And this on its own indicates what's called a wind invasion. So an external pathogen coming in, and you'll usually feel this you will feel this on the lung pulse if that's the case. As the lung is what is kind of tied to our immune system, and is what is going to be kind of the front line for interacting with this external pathogen in the case of a cold or a flu or something like that, a virus. And so so this, and also as we were saying before, this pulse, just to go back to yin deficiency, the yin deficient pulse may have a floating quality as well, but it's also going to be tight and maybe rapid. So that way you can distinguish that between a floating pulse that's indicating a wind invasion, and also if you feel the floating pulse on more than just the lung pulse, it could indicate, if it's like a systemic thing, indicate yin deficiency. And then a sinking or a deep pulse, the opposite, so it's distinct only at a deep level. So this could indicate an internal disharmony or an obstruction, and when paired with with other qualities like weak and slow, this is indicative of yang deficiency. And next we'll go on to speed. So in Chinese medicine, fewer than 4 beats per breath is considered slow, where more than 5 beats per breath is considered rapid. And this is the patient's own breath. So you can sync your patient, or obviously if it's just yourself, you can just pay attention to your rise and fall of your breath as you listen to your pulse, or if you're listening to someone else's, kind of sync your breath up with theirs, if possible, and feel. I don't usually get so particular. I maybe just from experience, you kind of get a feel for what feels a little fast versus moderate or slow. But if you want to get really exact, you can do that. And you can also set a timer and just count the beats over the course of 15 seconds or over 30 seconds or just a full minute. And so in Western terms, the norm or the average heart rate is typically noted as 60 to 100 beats per minute, and the typical breath rate as 12 to as high as 20 breaths per minute. And if you do the math on this, my learning was that 12 to 16 breaths per minute is a healthy range. So if you do the math on that, it would be like 48 beats per minute to 64 beats per minute would be kind of in the healthy range in Chinese medicine. So really on the low end of what's considered average, more typical in athletes to have that pace. So just something to keep in mind. And in Western medicine terms, tachycardia or a high heart rate is considered over 100 beats per minute. So that would be well over what's considered rapid in Chinese medicine. So it's not necessarily alarming to feel a rapid pulse, and it's pretty common in people who are yin deficient to feel a bit of a rapidness to their pulse. Or maybe if someone's been talking and they're excited or they're just getting settled, their pulse may be a little faster, so you can give them a minute to kind of acclimate if you're listening to someone else's pulse before you check in with their speed of their pulse. And so what these indicate is for a slow pulse on its own indicates cold in the body or qi deficiency. And if it's also weak and deep, a yang deficiency. And rapid pulses indicate heat. And then width, so you could have a thin pulse, which might be described as fine or thready, but it has a distinctness to it, and this is indicative of blood deficiency. A pulse that feels broad in diameter and distinct is called big, and this on its own indicates heat in the stomach and or the intestines. So this you might probably feel on the spleen pulse, that's the pulse that kind of associated with our digestive organs. So moving on to strength. So an empty pulse is one that feels it feels big, but it doesn't have strength to it, and you usually feel this at the superficial or the qi level. It's also been described as a pulse that feels weak and soft, like a balloon partially filled with water. And so this indicates qi deficiency. It may also indicate blood deficiency. And a full pulse, also known as pounding, is one that feels big and strong at all three levels. It's kind of like pounding against your fingers, and this indicates excess of some kind. So it might be, it depends on what the other signs and symptoms are. And different shapes of the pulses. So we talked a bit about all of these, but we'll dig in a little bit more. The slippery pulse has many different descriptions, but there's a fluidity to it, there's a smoothness to it. We were saying before, it kind of like slips around your finger, like you can't really get a feel. You get your finger on it. It's been described like a ball bearing covered with viscous fluid, or I think this one was from some classical text, feeling pearls in a porcelain basin, if you've ever done that or can imagine. Some people say it slithers like a snake. But yeah, there's just this like slippery, yeah, it's called slippery. So there's this kind of like a fluid quality to it. And whether or not it's kind of soft or it's more of a full pulse will tell you whether it's an excess or an underlying deficient condition. And then the choppy pulse. So we were describing that before in a number of different ways, like some say it feels like leaves and twigs, or it feels like rocks in a river that's run kind of dry, or in the classics it says like a knife scraping bamboo, or a sick silkworm eating a mulberry leaf. You can get very imaginative with these descriptions. But there's going to be some kind of like a roughness to it, or an irregularity to its strength and fullness. So not an irregularity to the in terms of rhythm, but in terms of like texture or strength. And this indicates blood stagnation. If it's also thin, this could indicate underlying blood deficiency. And then the wiry pulse, as we were saying before, can feel like a guitar string. Kind of, there's like a tautness to it. It rebounds against pressure at all levels and hits the fingers evenly. As opposed to the slippery pulse, there's no fluidity to this pulse, at least if it's existing on its own. And it is indicative of chi stagnation, so it's usually related to disharmony that impairs the flowing and spreading functions of the liver and gallbladder, which are responsible for the smooth flow of chi. So as we were saying before, that's a pulse you'll feel especially on the liver, whereas the slippery pulse especially on the spleen. And then a tight pulse. So I've heard some kind of contradictory things about the tight pulse. I've heard that it's like a thin, hard pulse, but it could also apparently be like a not thin, but there's going to be like a hardness to it, but more elasticity than a wiry pulse. So there's so just to distinguish it from a wiry pulse, it's not quite as taut. I understand it to be a thin pulse, but apparently it's fuller than a wiry pulse. So I think when you look at the person holistically, you can kind of get a better sense of what it is you're feeling. On its own, a tight pulse could indicate excess, cold, or stagnation, and like we were saying before, this pulse quality paired with the floating quality, and maybe the rapidness could be indicative of yin deficiency. And then length. So a short pulse is a pulse that does not fill the spaces under the 3 fingers, so that those 3 pulse positions, and it's usually felt only in one of those positions, and this indicates qi deficiency. Whereas a long pulse is perceptible beyond the 1st and 3rd positions, and if it's also tight or wiry, this indicates some kind of excess condition. And last category is rhythm. So the pulse, of course, could be regular. These are all irregular pulse qualities. So there are some pulse qualities that are irregularly irregular, and some, or one, the intermittent pulse, which is regularly irregular. So meaning that it's the same pattern of skipped beats versus the knotted and hurried pulses. It's a random pattern of skipped beats. The knotted pulse is slow and irregularly irregular, indicating cold, obstructing the qi and blood, or it could be a qi, blood, or jing deficiency. Jing is often translated as essence. That is something that is kind of a substance that we come into this life with. Some people kind of link it to our DNA. It is associated with the kidneys, and we don't need to get too much into that, but basically a deficient pulse quality that perhaps also indicates cold. The hurried pulse is rapid and irregularly irregular, indicating heat agitating the qi and blood. And then finally, the intermittent pulse is the one that is regularly irregular. But this usually skips more beats than the hurried or the knotted pulses. And this often indicates a severe heart disharmony or an exhausted state of all the organs. So it's serious business. And then the last pulse quality we will mention is the moderate pulse, which you probably won't run into too much of, and it's not really necessary for health. People, tend to kind of have their own constitutional norm. So you might be someone who just has a little slipperiness to all your pulses, or a little wiriness, depending on who you are constitutionally, how you are. But a healthy, balanced pulse is considered normal in all those ways we just talked about: depth, speed, strength, width, and rhythm. And I think, as I mentioned in the first class, what I look for, like after acupuncture treatments, if I listen to the pulses before and after, is more of a harmony between the pulses, or like an evenness, whereas before it might have felt like a little cacophonous, and afterwards there's more of a harmony. So that's what I look for. Now there are 10 more qualities that we're not going to get into, because these are really getting into the nitty-gritty, and they're considered combinations or refinements of the other 18 qualities we just went over. But if you are interested in learning more about them, as I mentioned, the Web That Has No Weaver is a great resource, which I will share more details about at the end. And so now just continue practicing, and as you do, you can note, first and foremost, can you feel the pulses? Do you feel them in all three positions, at all three depths? How does it meet your finger, if at all? If you're a visual person, you can draw it out, and ask yourself, does it resist your pressure? Does it yield? And like we were talking about before, if listening to someone else's pulses, you can sync your breath with theirs to assess how many beats per breath, or if there are any skipped beats. You can also set a timer if it's easier to count beats per minute. And also, you can set a timer to count the beats, and then once you do that, set a timer to count their breaths per minute. Easier to do that if you're being stealthy, because I feel like the breath can get, if you're self-conscious, your breathing rate might change. But you can do that to try to figure out someone's breaths per minute, and then from there do some math to see whether their rate is considered slow or fast or normal. And again, I was saying that 48 to 64 beats per minute is what seems to be considered the healthy pulse rate in Chinese medicine. Also, you can ask yourself if you think you feel a certain quality, because these qualities are, it's going to take time to learn these qualities and get confident. There's such nuance to it, and there's always going to be, or often going to be, mixtures of qualities that make it really hard to distinguish. So if you, to try to learn these qualities, you can just observe the person, observe their complexion, their body, to kind of get a sense of what might be their constitution, or what might be some patterns of pathology for them. Obviously, you cannot truly diagnose someone just by looking at them as a beginner, certainly, but it can kind of help you in the beginning to put some pieces together, or maybe even ask questions if you feel it's appropriate. So for example, if you feel like a weak pulse quality, is the person really tired or fatigued? If it's thin, which would indicate blood deficiency, do they have a tendency towards dizziness or feeling kind of unstable, or are they restless or anxious? Do they have trouble falling asleep? Slippery, do they have digestive issues, feel like a heaviness, a weariness? Also, we didn't mention pregnancy will result in a slippery pulse. So that's an example where a slippery pulse is healthy, and you can, if you want to learn what a slippery pulse feels like, and you know someone who's pregnant and willing to let you listen, you can give a listen to their pulses, because a pregnant person's pulse should be slippery, because they're kind of accumulating this, right? It's an accumulation of sorts inside them, so it's causes that pulse quality. For a wiry pulse, maybe they tend towards frustration or pent-up emotion. Maybe they have some physical discomfort or pain that's kind of comes and goes, or isn't super severe. Whereas a choppy pulse, maybe they do have really severe pain or menstrual cramps, or other menstrual issues, blood clots in their menstrual blood, or an irregular period. That could be due to blood stagnation. Blood deficiency can also definitely play a role in menstrual issues as well. And this is that book that I was mentioning, and the author's name. If you're interested in further reading, that is a really great resource. It was the book that actually introduced me to Chinese medicine and put me on this path. So I recommend it if you haven't read it, and goes into a lot of detail about the pulses, as well as as well as Chinese medicine in general. So that concludes part 2 of Intro to Pulse Diagnosis. Unless you have any questions, please feel free to text me at that number. And also feel free to email me if you want this slide deck. I'm happy to share it with you. And once again, my name is Michelle Morisi, licensed acupuncturist and Chinese medicine practitioner. I work at Wu Healing Center and in Rhode Island, where I'm based out of. So thank you for attending, and I hope you have a great day.